Hi everyone, it's board certified plastic surgeon Sean Doherty coming to you from Boston. A topic that has been requested a lot is what to do about the neck. I find that a lot of my patients in their 40s or even early 50s come in and say, yesterday my neck was up here, now it's down here, or I'm starting to look like my mother or my father, I'm starting to create some turkey neck. So what can I do? So let's talk about the many options, non-invasive to more invasive. So non-invasive things would be topical things, so treatments, skin treatments. So technically anything you put on your face to help stimulate your skin, which will be exfoliants, retinols, things that have hyaluronic acid in them, to just improve the tonicity and kind of quality of the skin, should go on your face, should go on your neck, should go on your chest, and should go on your hands. So that's one thing. Then there are less invasive treatments that could be done. In my office, these are typically done by estheticians. So think of ways to stimulate your skin. So microneedling treatment, that's done fairly superficially in line with the type of care that an esthetician can provide. Needles go along your skin with an approved device that stimulate the surface of the skin. They don't go in very deep when an esthetician does this. A very good treatment that's done in series is a radiofrequency treatment. And radiofrequency delivers heat with a wand that's placed over the skin. It heats the tissue underneath the skin, and that suggests some skin tightening. And a really good device is TempSure, and you'll see some videos on my channel soon where I can discuss that procedure. That's done by estheticians. It can be done once a week or even more often than that to help stimulate the skin. It does not do this, but it helps stimulate the skin. Next up would be some more invasive procedures that I would do. So oftentimes to help stimulate the tissue underneath the skin, I'll put something there, and that would be non-barbed threads. So we know threads that lift up like this, but threads that are placed underneath the skin have a stimulatory effect. And I often do that along this skin here because people are bothered by the crepiness and horizontal lines there. And threads do not take those lines away, but it helps improve the quality of the skin, and therefore those bothersome lines are less bothersome. Dilute filler, so dilute Juvederm or Restylane, can often be placed with a very thin needle underneath the skin to have that same stimulatory effect. Next up would be more procedures that in this office are done by a physician. So the profound procedure, which is a combination of microneedling and radiofrequency, is performed here in the lower face and or the neck. It literally is like a stapling device. Once I numb your skin, don't worry, the stapling device goes through the skin, and the 5 pairs of needles, so 10 needles go underneath the skin, stimulate the skin by creating an effect, by creating trauma, which is a controlled trauma, and then heat is delivered when those needles are underneath the skin to deliver radiofrequency. And like I just said earlier, radiofrequency is associated with skin tightening. Again, that can be done here and here. That has about 3 to 5 days of downtime looking swollen in that area. It ultimately takes about 3 months to see the effects of that, and that can have a subtle sort of improvement. If you're looking for more something like this and bothered by volume here, perhaps we need to talk about something that's a little bit more aggressive. So kind of a non-invasive trio of procedures that I like to do is liposuction, so along here, so to decrease some of the volume that's underneath the skin here. That is a procedure, surgery that's done in the operating room, but can be done under local anesthesia for the right patient. So once I've removed some of that volume here, I can place threads underneath the skin, and please see some earlier videos where I've discussed that. That can help define here. That is a very nice duo of treatments. Then I also think it's a good time to take advantage of some downtime in the fact that you're in my chair and stimulate the skin with some microneedling at that point. That's a nice trio of non-invasive surgery. And then next up is surgery. I feel like a lot of people are asked for non-invasive procedures. They don't want the downtime, they don't want incision, and the cost is a little bit challenging, and I completely understand that and respect that. But if you're doing this with your face, lifting up, and you're bothered by this volume here, ultimately we're talking about surgery. Surgery does not mean that you are going to be windswept and pulled back and look odd or not anatomic, and that's not really my goal to create that type of change in a patient. I'd like to create a smooth, subtle improvement that takes away some of that laxity, but does not create someone who looks like a different person. So a neck lift is an incision that's around the ears in front and then in back. And that allows me to see the underlying tissue, which is the muscle that's underneath the skin that has descended. I can then lift that up. And then once I've lifted up the muscle, I lay the skin back down kind of where it's supposed to be and then trim the excess. That's essentially a face neck lift. And don't get caught up on what's a facelift, what's a neck lift, but it's really sort of treating what the problem is. Those procedures are successfully combined with some volume around here and here, which could be done with fat or filler, microneedling or laser resurfacing, or even chemical peel around the rest of the face to take advantage of the downtime that you're going through to help really kind of treat all the age processes. This is just a before and after picture. So before, after, this is about 1 month after a neck lift. And so the incisions are still healing, but that just gives an idea of kind of what can be done. All right, please visit me on social media. Please reach out. I hope you're doing well, and I hope that was helpful. Thanks so much.